So we did this survey to understand the landscape around biomarker testing globally in 2018. We found a lot of barriers to optimizing testing. And since 2018, there's been a lot of changes in who should be tested and what treatments are available. And so we repeated the survey this year in 2024, and this was a joint project with the IASLC and the IASLC Partners Group. And so we did the survey, and we took a mixed methods approach this time. We did some qualitative focus groups and in-depth interviews first to understand what do we really need to be asking. So we talked to a lot of key opinion leaders and experts in the field, and then we did the quantitative survey. We found that basically in the focus groups, we found that there's been a paradigm shift in the way that we should think about biomarker testing. It's no longer a nice-to-have thing. Now it's a have-to-have thing for patients with lung cancer. And so we really need to make sure we get everyone biomarker tested that has lung cancer and figure out how to optimize those processes. We found that the perception is that things have gotten a little better since the last survey. And people generally agree that targeted therapy works, but people are not totally on board with comprehensive biomarker testing for everyone with lung cancer. So there's still some barriers. There's still some barriers including cost, access, and the quality of the sample. So there's some process level things that we can fix. And there's also, one other statistic was that 43% of the respondents said they sometimes or often treat patients without having the biomarker status information first. And so there's still an implementation gap. And really, I think around the barriers, we have to address access first. We have to address awareness first. So people have to be aware that everyone should get this and on board with testing. Once we can do that, then it's access and process. So once everybody agrees that we all need to be doing this 100% of the time, then we need to figure out what are the process level barriers we can fix, and why do some people not have access? How can we reduce the cost enough that we can make sure that it's equitable distribution of testing? And then finally, we need policy changes to address this really at a high level.